I do have so many questions regarding implant prosthetics, especially full mouths. Which one is better? I mean, 1 implant, 2 implant, 3 implant, 4 implant, 5 implant, 6 implant, 7 implant, and as 9 implant, 10 implant. Which one is better? Well, really, case by cases actually. So not only that, their patient's budget and their chewing habit, and then their TMJ, which is I'm not a dentist, and then I'm a dental lab technician. So I do really fortunate. We do have a lot of full mouth implant cases. Usually I do a lot of tough cases. That's why I'm losing my hair here. But that's my joy, and then I just take a look at the cases. Not only fabricate it, before we fabricate it, just diagnosis first, just like the doctor. I'm just pretended doctor, okay? If we need a consult for dental or teeth, contact your dentist, okay? Nationwide dentist. We have a lot of nationwide dentists who work with me this proudly. Anyway, the case is this implant, regardless how many implants, and I would like to explain to you what did I do previously, the implantology for these cases. Patient don't have any teeth, here's missing, here's a couple teeth left, and then here's a couple teeth left. What is the options? Well, if we don't have any money, there's partial options. You know, you're not going to embarrass missing teeth, right? So you need some kind of teeth. We call partial. Partial is so many options, which is acrylic, flex partial, whatever. So we made it as flex partial and lower, and then our bird's nice deluxe denture. All right. After time goes by, depends on the patient. They don't want to brush their teeth, and they have a problem, perio problem, they're pulling out the teeth again. So then they need another implant, just like 2 implants. So we're using the another partial. They like it, they don't like it. They don't have any option, unfortunately. So 2 made it, and then upper we made it. So now as the game goes on, depends on the patient's budget, depends on doctor's fee, depends on the laboratory fee. So after 2 implant and 3 implant, we especially lower here, which is mini implant, so many options. Mini implant, we do over denture, take it out in, which is removable. You can do that. Or you can make the 4 implant the top, which is the hybrid acrylic, which is screw retain hybrid acrylic, and then you can do that too. Or you have a little bit more money, you could make screw retain hybrid zirconia. You need a little bit more fancy, then I can make a little bit layer, then make it pretty, right? The pros and cons, I just put it in the link here. I made so many videos, pros and cons about acrylic, hybrid acrylic, and compared to hybrid zirconia. So I put down nice video over there, so I will explain to you guys. Then they need a so fancy, whatever reason. For example, they don't have any teeth, they place implant here. So doctor place implant, but patient don't want to fix. We can make the removable, just a locator dentures, we can do that. Or no, I don't like the removable, I want the fixed. So we make the 7-star case, which individual looking restorations. Not many people can do here. Why? They need a milling machine, and then they need a sophisticated design from the frame, and then final restoration. And not only that, porcelain skill, we have to bake it. Everybody can do it, but I see that one is not that great looking. What I'm talking about, the top of the line aesthetic, from the gum, texture, coloring, tooth design, translucency, occlusion. That's what I'm talking about. Regardless, how can I judge it? We discussed with the dentist, and the dentist took the video and sent a lot of photo. And then as we can see in the patient's mouth, then we can tell how many forces, you know, just like one tone, the pressure, just like pressure, just cracking. They're cracking everything, then problem. So you have to using more strong materials, which is protected for the porcelain restoration for longevity, I call. Or you don't mind to see your dentist all the time, whatever reason, and do it. And then whenever you crack, they're patching it, they add it, they can re-add it for you. And some people don't have any time, they're businessmen, they're super rush, so they want good, solid, and the good prosthetics cases from, like I said, from 1 implant, 2 implant, all the way 8, 9, whatever, 14 implant is over-engineered, which is not recommended lately, which is the really good technology out there. So 5, 6 is plenty of the strength support. And top of that, we make removable acrylic or zirconia or individual restorations we can offer you. Anyway, bottom line is here, as I show this one, patient has the natural teeth, so we made a nice partial with attachment, and then we exactly matching top and bottom. Top we made the Citin 4500 with zirconia highest aesthetic tissue design. That is the bottom line. And then we try to give them protection, which is longevity. Most of the time, people never contact me. You know why? Because they're happy. Whenever they're not happy, they contact me immediately, which is I don't mind. But this is a good video, and I hope you will help. And then I appreciate. Thanks for the watching. See you next time.
Thank you.